All right, so we're diving into these excerpts you sent over from Schizophrenia by Kevin and Vamik Volkan. And right away, bam, they're challenging how we even define schizophrenia, saying it's not just one thing, but a whole spectrum.
Yeah, it's a really interesting way to look at it because thinking of it as a spectrum, it changes how we think about diagnosis, and even treatment. Like someone might have symptoms for a short while and then they're fine, totally recover. That's schizophreniform disorder.
Oh,
Or they might have, this schizophrenia symptoms, but also a mood disorder going on, like depression. That'd be schizoaffective disorder. So each point on the spectrum needs its own approach.
so it's not just a yes or no kind of thing with a schizophrenia diagnosis.
Exactly. It's way more nuanced.
And that actually, I think, is a good segue into some of those eye-opening stats the book throws out. Around 1% of people, right, they're affected by this. Usually it's hitting during adolescence or young adulthood, more common in men we see here. But get this, where you live matters. Your ethnicity, even what time of year you're born, the book says that can play a role.
It's wild, right? Shows how connected our mental health is to our environment, the whole social context. Like some researchers think even being exposed to certain viruses when your mom was pregnant with you, that could be linked to a slightly higher risk later on.
Wow.
And then there's the stress of city life, right? Or even migrating to a whole new place. Studies show that can impact mental health too.
Huh. It's like our surroundings really do get under our skin.
They do.
And speaking of getting under our skin, this part blew my mind. The book talks about how schizophrenia isn't just this mental thing. It's linked to a way higher risk of physical health problems, too.
Oh, yeah.
Heart attacks, dental problems, even getting the flu. It's all connected.
It is. And the authors, who are, by the way, a psychologist and a psychiatrist working together, they stress that we got to look at the whole picture, holistically. They're saying a lot of these physical problems actually stem from lifestyle factors. So smoking, bad diet, not enough exercise, which unfortunately are more common among people with schizophrenia.
Oh, I see.
So if we can support healthier choices, it can make a huge difference for their well-being overall.
Okay, so we've talked spectrum, we've talked the surprising role our environment plays, but let's get into the real mystery here. What causes schizophrenia in the first place? The book dives into some really interesting possibilities.
It does. It's like a medical detective story. Clues all over the place. Genes definitely matter, especially if it runs in your family,
Right.
But it's not as simple as just inheriting a schizophrenia gene. Think of your DNA like a giant library, okay? Schizophrenia, that's like one book in there, but its chapters are scattered all over the place.
So it's more like puzzle pieces than one single gene?
Exactly. And here's the kicker. Those pieces, they can be flipped on or off by our environment, our experiences. That's where epigenetics comes in.
Oh, right, right.
So basically, your life story, the traumas, the good times, even what you eat, it can switch certain genes on or off, and that might make you more or less likely to actually develop schizophrenia.
It's like our environment is writing notes in the margins of our DNA.
That's a great way to put it.
That's incredible. But hold on, because the book takes us down another fascinating path here, revisiting this whole thing about infections and mental illness.
Right, right.
You've probably seen the headlines.
It's true. We're way past the days of lobotomies and yanking out teeth to cure this, but new research is saying that being exposed to certain infections, especially while you're still in the womb, that might actually increase the risk of schizophrenia down the line. One example, Toxoplasma gondii, that parasite thing you can get from cats.
Oh, wow. So something so common could have that kind of impact.
Potentially, yeah.
And speaking of impact, the book doesn't shy away from those tougher topics either. Childhood trauma.
Yeah.
How's that potentially linked to schizophrenia?
Well, think about it. Bad experiences, particularly early on, they can have a lasting effect on how our brains develop. Like imagine a tree, right, growing up. If it's constantly hit with strong winds, it might end up a bit crooked.
Yeah.
Not always, but it's a factor.
Powerful imagery. It really drives the point home. Our past experiences, good and bad, they really shape us in a deep way.
Absolutely. And the book goes on to even explore how things like drug use, especially cannabis, can play a role in this whole puzzle.
Oh, that's a big one. So does drug use increase the risk, or are people self-medicating symptoms they already have? It's like, which came first, the chicken or the egg?
It really is. And the book digs into the latest research on this, and it seems like, particularly with heavy cannabis use during those teenage years, it might slightly increase the risk of schizophrenia, but only in people who are already kind of genetically predisposed to it.
Really?
But yeah, more research is definitely needed on that.
So we've got this whole web of potential risks, right? From our genes to what we go through, where we even live. But let's zoom in on the brain for a sec. What's actually happening in there when someone has schizophrenia?
Well, it's complicated. The book really gets into the nitty-gritty, talking about neurotransmitters. Those are like the messengers in our brains.
Oh, right, the chemicals.
Yeah, exactly. They let different parts of the brain talk to each other. Like, imagine tiny little emails zipping back and forth.
Okay, I can picture that.
Now, in schizophrenia, it's like those emails are getting lost, delayed, maybe going to the wrong inbox completely. Dopamine, GABA, serotonin, these are some of the big players that get out of whack.
So it's not just like you have too much or too little, it's more about the whole system getting messed up.
Exactly. And that's where that dopamine hypothesis comes in. You've probably heard of it. It's been around. But basically, it suggests that in certain parts of the brain, if the dopamine system's going haywire, that might be a big part of why people experience psychosis.
So, like, dopamine is that friend who's always got a crazy story, but sometimes it gets a little too unreal.
I like that analogy. But it's not just dopamine, of course. You got GABA, which helps keep things calm, serotonin affecting mood. All these things got to be working together. When they're off, it throws everything off.
It's like an orchestra playing out of tune.
Exactly. A recipe for, well, for lack of a better word, craziness.
Right, right. But the book goes even deeper, talking about how even the structure of the brain itself might be different in people with schizophrenia. What's that all about?
So think about this. Imagine two buildings, okay? Same purpose, but they were built from slightly different blueprints. You might notice the rooms are different sizes, the windows are in different spots, maybe the hallways connect differently.
Okay, I'm following.
Studies have actually shown that's kind of what's going on in the brain with schizophrenia. There are subtle but real differences, especially in a couple key areas. The anterior cingulate cortex, ACC for short, and then the limbic system. Those ring a bell.
Vaguely. Aren't those the parts that handle emotions, making decisions, how we act around other people?
Ding, 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 we've got a winner. And guess what? Those are often the areas that are struggling in schizophrenia. The ACC is like our emotional traffic cop, keeps things flowing smoothly. Limbic system, that's where we process emotions, make memories. So if those are different, it makes sense why people would have a hard time reading social cues or regulating their own feelings.
It's like their internal GPS is a little off, makes it harder to navigate the world.
Perfect way to put it. And you can imagine how isolating that can be, right?
Right.
Makes it tough to build relationships, hold a job, just enjoy life, really.
It really highlights that this isn't just in their heads, it affects their whole world. But, okay, enough doom and gloom. Let's talk about how we help. The book takes us on this whole journey through how schizophrenia has been treated, from the truly awful to some really promising new stuff.
It's a wild ride, that's for sure. Back in the day, before we understood the brain, the treatments were often based on, well, basically nothing. Superstitions, fear, bad theories, you name it.
Like trepanation, drilling holes in the skull to let out spirits.
Exactly. Or spinning patients around like crazy, hydrotherapy, even putting them in comas with insulin. Wild stuff.
Makes you grateful for how far we've come. Evidence-based treatment, thank goodness.
Absolutely. And speaking of progress, the invention of antipsychotic meds in the 50s, that was huge. Finally, there's a way to get a handle on those really intense symptoms, hallucinations, delusions, all that.
So it was like turning down the volume on those distressing thoughts.
In a way, yeah. But we got to be real, antipsychotics aren't a cure. They work by blocking certain dopamine receptors, which helps with the psychosis, but they often come with side effects too, and some can be pretty rough.
So it's a balancing act, finding the right med, the right dose, to manage things without causing more problems.
Exactly. And that's why researchers are always on the hunt for better, more targeted treatments. It's not just about making symptoms go away, it's about improving quality of life for people.
Right, so meds are part of it, but not the whole story. The book talks about how therapy is becoming more and more important too, alongside medication.
100%. Used to be, people thought therapy wouldn't work, or even that it could be bad for schizophrenia.
Yeah.
But now, we know it can be super helpful. Gives people tools to cope, challenges those negative thought patterns, helps with social skills.
So it's like giving them a toolkit to navigate all the challenges.
Exactly. One of the best ones out there is cognitive behavioral therapy, CBT. It helps people identify and change the thoughts and behaviors that are causing them distress.
So instead of trying to make the hallucinations go away, it's more about learning to live with them.
Exactly. It's empowering, gives them back a sense of control. And there are other approaches too, like psychodynamic therapy, that dig into how past experiences might be playing a role.
Sounds like it's all about finding the right combo, meds, therapy, lifestyle changes to help people live their best lives.
You got it. And while we've made amazing progress, the book doesn't stop there. It looks ahead to the future of treatment, and it's pretty exciting stuff. We're talking about totally new ways to target the brain and how it works.
So, new ways to target the brain, what are we talking about here?
Well, one really promising area is neuromodulation. It's basically about directly influencing brain activity. Kind of wild.
How does that even work?
So one way is with TMS, that's transcranial magnetic stimulation. Sounds sci-fi, right? But they use these magnetic pulses, kind of like little zaps from outside the head, to stimulate specific brain areas.
Just like a little brain reboot.
Exactly. And then there's deep brain stimulation, or DDS. That's where they actually implant tiny electrodes in certain brain areas.
Inside the brain? That sounds intense.
It is. It's still experimental for schizophrenia, but it's showing promise for things like Parkinson's. It's like a pacemaker for your brain. Keeps those electrical impulses going where they should.
Wow, so we're talking about actually changing how the brain functions.
In a way, yeah. But it's not all about the brain itself. The book also gets into inflammation and the immune system, that whole connection to schizophrenia.
Oh, right. I'd heard about that, something about the immune system being overactive.
Yeah, it's called psychoneuroimmunology. Basically how our minds, our immune systems, and our environment all talk to each other. Turns out, people with schizophrenia, they often have some funky stuff going on with their immune response. Like it's stuck on high alert, even when there's no real threat.
Huh. So like their body's fighting something that's not even there.
Kind of, and that constant inflammation, it might actually be part of what's causing the brain changes we see in schizophrenia. So now researchers are looking at anti-inflammatory meds, the kind people use for like arthritis, to see if that can help calm things down and maybe improve symptoms.
It all comes back to that mind-body connection, huh? So interesting how everything's linked. But the book didn't just focus on, like, the physical stuff, did it? There was a whole section on culture and how that plays in.
Absolutely. It's a crucial piece of the puzzle and often overlooked. The book really challenges us to think beyond just the biology and consider the social and cultural context, Like, how do people in different cultures interpret these experiences? What's considered normal in one place might be totally different somewhere else.
So, like, what one person sees as a hallucination, another person might see as a spiritual experience.
Exactly.
Yeah.
And that can make a huge difference in how they seek help, the kind of support they get, the whole 9 yards. The book really stresses how important cultural sensitivity is, both in diagnosing and treating schizophrenia.
We got to meet people where they're at, right?
100%.
Yeah.
And it goes even deeper than that. The book suggests that culture itself might even contribute to the development of schizophrenia in some cases.
Really? How so?
Well, think about the stress of migrating to a new country, dealing with discrimination, feeling isolated. Those are all huge stressors, especially when you're young and your brain's still developing.
Yeah.
So for someone who's already genetically vulnerable, those experiences, they could be the tipping point,
It's like the environment can either help those seeds grow or it can really make things difficult.
Perfectly said.
Yeah.
And that's why we need to look at this from every angle. Genes, environment, culture, the whole shebang.
This deep dive has been incredible. We've covered so much ground, the history, the science, even the cultural side of schizophrenia.
It's been a journey.
It really has. If there's one thing you want our listeners to walk away with today, what would it be?
For me, the biggest takeaway is that we've come a long way, but there's still so much we don't know about schizophrenia. It's complex, it's challenging, but most importantly, it's human.
Yeah.
Behind every diagnosis, every symptom, there's a person with their own story, their own strengths.
Mm-hmm.
And if we can remember that, if we can approach this with curiosity and compassion, that's where real progress happens.
Beautifully said. And to our listeners, this is just the start. Keep asking questions, keep learning, and keep an open mind because there's always more to discover.